Hello, I'm really pleased to be able to talk to you today about the role of social workers in personalising care and support for the people we work with. Personalising care and support, or personalisation, actually is at the heart of really good social work practice. And whilst it may be a relatively new term, in fact that's what social work has been about for many, many years. Making sure that the person that you're working with, or the individual and their family that you're working with, really are at the centre of what you're doing, of really making sure that the key thing firstly is to make use of the personal, professional use of self in engaging with, attuning to, and really understanding and listening and hearing the people that you're working with, and shaping with them the outcomes that they want to achieve for themselves. That's at the heart of social work: client self-determination, respect, listening, supporting people's human rights, ensuring that risk is balanced against promoting independence. These are the core things that social workers do day in and day out. And I think the role that social workers can play today in the 21st century in really personalising people's care and support and personalising their experience of working with social workers and social care is something that it's social workers who can really lead on and support. One of the things I think sometimes is we get caught up in the kind of mechanisms of personalisation, so the direct payment or the personal budget, but actually personalisation is a much bigger picture than that, and it's about making sure that the approach is human, that we really do understand and listen and support people, that we have the kind of core values and ethics of social work, which is about dignity, respecting diversity, working with people's preferences and lifestyles, and ensuring that what it is they want for themselves is the thing that really happens. The other thing I think that's really key that social workers can contribute as a key role is personalising people's experience of the wider services or support that they need. And it's interesting because I think the notion of now starting to personalise people's experience of health services or hospital services is coming to the fore as well. And social workers, I think, have a key role to play in encouraging and supporting and role modelling for other professionals in the wider health and social care system, the way in which we can really get alongside people, listen to them, respect them, and work with them as equal partners in shaping and designing the care and support that they need, and wherever possible linking them to and connecting them to the things that are available in their local communities or within their own resource networks through their family and friends or neighbourhoods. Mostly people want to live as independently and in the way that other people live, and linking into libraries or leisure centres or being able to use local transport or to get involved in the kinds of things that everybody else is getting involved in are key. And social workers have a role to play in paving the way for that and influencing and shaping what's available locally, both through their work individually with people, but also through their role as people working in particular agencies. I think social workers have made a real contribution in local authorities in really shifting the balance towards being very resident focused, and that it's the people that we're there to serve, and how is it that what we do makes a difference and improves the lives of the people who live in that particular place. I think there's a huge scope in the more challenging areas, for example in mental health work and in a lot of the work around capacity now, to keep the focus on really ensuring that those people do get a very personalised response, and that their needs and wishes and that their decisions are respected as well as they can be. And I think the Capacity Act has been a really interesting way of thinking about personalising support, because having to be very decision specific and assess people's ability to be able to do that has really made us think very well about who is this person and what are the things that actually they should continue to have some choice and control over. Equally, a lot of the work that's going on now around making safeguarding personal, I think, has really been very cutting edge and innovative, and in fact I think we've got a kind of a bit of a step up on children's work here, because we've moved away from trying to be so procedurally and process driven to making sure we start off by asking the person what is the outcome that they want, what support do they need to have as much control over what's happening, and where do they want to be at the end of it, and what was that experience like for them. And all the evidence from those pilots is suggesting that that's such a much more effective way of working with people and treating them as equal partners in shaping the future for them. So I think I'll kind of stop there, but I do want you to go away with a message from me, which is I really believe that putting social workers back at the heart of adult social care and really putting the kind of strong, well-embedded values and ways of working with people that social work has been developing for many years is going to be key to really achieving the improvements that we want to achieve in terms of people's experience of care and support in England today.